Welcome to the So You Want to Work in Healthcare podcast today. I'm so excited to introduce Dr. Sanjay Juneja. He is a hematologist oncologist, also an entrepreneur, podcast host, and social media personality. So welcome.
Thank you for having me. It's exciting to
Yeah.
be here. We've gotten to know each other well. Your content's hilarious. So it's fun to get together.
Thank you. Yeah, I remember you were one of the first people who messaged me on TikTok back in the day, and I was like, wait, what? This guy likes my content? This is crazy. It was before I knew what I was doing at all. I was very green, and I
Right.
was just like, this is cool. So thank you for giving me the encouragement to continue with that.
Yeah. It's hard to find, valuable content that's also, where you want the character of the person and the nature. There's just so many, it's hard to know what you're getting. And so when you find a creator that's like means well, integrity, it just really shows in your content. So
Oh, well, thank you. I appreciate that. The whole point of this podcast is to help guide people who might want to go into the medical field, become a physician, a PA, nurse practitioner, whatever it may be. So my whole goal with this is to just interview as many people as possible and get your story, see what you did to get to where you are today, and hopefully give students some tips on how to do what you're doing and talk about a little bit about how you also have branched out into the entrepreneurial world. So, my first question I like to start with is why medicine and when did you know you wanted to go into medicine?
yeah, so I guess mine is a little unique, but not really when it's full circle. I really wanted to be a middle school teacher for a long time. So I had a couple of very impactful teachers in third grade, Miss Emine, Miss Rayner in fifth grade, still remember their names, and then Mr. Duvall in middle school. And it was because the level of reward or magic that happens when something makes sense, when you make a connection or sense of something in the world around you, it just, I think, really increases the value and really the humility at the end of the day of how beautifully orchestrated our world is, whether it's in physics, like I was thinking of doing, or biology or physiology. It's, you appreciate things more when you know about them, right? Like if you see like this, some of my friends like, look at that car, do you know this, whatever. I'm like, oh, it's nice, it's pretty. And they're like, oh, but then they tell you everything about the engine. Then now suddenly there's more value to that. And I think the world in some ways actually lacks that today. Like, and I think it would make us appreciate how many, things are at play. But all that to say, that's what I wanted to do. And then I got into a pretty bad car accident in high school and I lost my eyesight completely in my left eye.
Oh,
And the
wow.
trauma caused, legal blindness considerably, where I really couldn't make out a face in both. And then people would ask, after the fact, which I recovered the sight, like, well, weren't you terrified? How was it to think that you wouldn't see again? Blah, blah, blah. And I was like, why wasn't I more terrified that I wouldn't be able to see and just living in fear? And it was really because my ophthalmologist, Dr. Grenier, basically, I didn't know anything medical at this point. And he told me everything that was going on with my eyes. Like, you have terrible iritis and, it's all kind of torn up and the pressure is 30, 35. And when it's high, it's pushing back on the fuel and the energy source that makes, your retina see and all this stuff. And so he's telling me the drops and why I hated them. Like, it hurts so bad, like the light when
Oh,
you have iritis coming in. But when I understood why, the pain became not only tolerable, a little more tolerable, but almost like a good pain, right? And so that is what I kind of recognized was the reason that a very otherwise scary experience that really had a lot more room to be terrifying and cause anxiety was significantly reduced. And
right.
that is what made me go into medicine because, doctor, in the Latin term is teacher, right? That's why PhDs are doctors and they were the first doctors. And so it was a bridge of teaching. And though I still love like physics and all this, I probably, my kids already hate me. I'm sure they're 8, 6, and 4, like guys. And I'm always teaching like, isn't it amazing that the suggested speed limit is because of the, the average tread on a tire and the frictional, the coefficient. But now it's very humbling to do that for a scary process. And I think there's, little as scary as cancer. So I was like, cancer is terrifying, whether it's stage 4 or it's curable. And there's a lot of room on the shelf that's left on how terrifying or what that experience is like. And I think the way to unlock that is the education, much in the same manner that I had for my accident and really my headspace for my, eyesight restoration.
Cool. Yeah. So that kind of answers the next question, why oncology? So, because you had this great experience with this physician, and then you see this kind of, I guess, would you say a gap in the care,
Yeah.
inspired you to go into that field?
Yeah, so took out the loans, did all that to med school, thought I was going to be an ophthalmologist, and then ended up hating it. Like
Oh,
it's,
no.
I know, no, it's, I'm just not somebody, and bless the people that are, but if I lose the autonomy to scratch my nose when it itches for the rest of my life, which is the equivalent of being in an OR, as you know well, like that, just like consider me the older son Indian prince thing. That's a cultural joke that they have, but truthfully, it's not that I hated it, but I was like, I don't know if I want to be surgical necessarily, and then I was thinking about ICU, critical care, because it's very, it's a closed system. Like you really understand the relationships of the physiology and pathophysiology that relate from the heart and all that. Like I love that, but I wasn't able to teach or know my, you know, audience, quote unquote, or like the patient well, right, and the family. So it was hard to navigate these very difficult decisions without knowing them. And then I had a couple of very foundational experiences at the VA and stuff in my rotations, where I would get, you know, a letter or two. I still remember my first one. They said, "Hey, I know you were thinking about cancer, but this is me telling you, like," and I think, you know, personally, God and the universe, whatever you believe, like there's some will of the world that facilitates signs. And I think that's where we find distress, when we're not open to the signs, when we think, what do I want to do? And it's almost impositional in the universe. Instead, say, what does the universe want me to do? And that letter was like, I can just tell you, my husband of 49 years, we didn't make 50, but, you know, Don, you know, Southern kind of backwoods guy, he's like, he's only told 3 men in his entire life that he loves them, his father and his 2 sons. You were the fourth. Like that was, you know, in that first letter. And that happened a couple of times. And I realized not just what happens during someone's care. We're all finite. Like there's a date above my head, you know, that, well, when I will expire. I don't know what it is, and it's scary, but it's also in a weird way encourages you to make the most of things. I realized that being a part of that experience in cancer and oncology also permits you not just for the experience of the patient or the person, but really what everyone that loved them is left with, that was involved in the care. Like even that can actually mar somebody's rest of their life with what they saw and happened with their father or mother or the kids, and didn't know that, understand why chemo makes people sick. And now you're just wondering, should I have ever let my dad go through that? And you're left with that for the rest of your life. But if you're taught and you're on board and you're excited about it, a good pain, right? Then all of a sudden that person's life is ameliorated too. And that's why I like the outpatient setting and the relationships, because you are given the purpose and responsibility to affect not just one, but many lives, and the quality and emotions that come after something so challenging.
Yeah, yeah, and it takes a strong person to do that, and I commend you for it because, I mean, I work in orthopedic surgery, which is like the least serious kind of surgery, right? And I still have a hard time taking on people's emotions all day because it is like super emotional. They're about to go through this big surgery. Sometimes it's their first surgery, and then you have to, make them feel comfortable, make the family member feel comfortable. So I can only imagine how much more magnified that is when
Hmm.
somebody has cancer. It's an elective surgery versus cancer. It's like not a comparison, but you must be a special person to deal with that, or not deal with it, to really want and love to do it every day.
Yeah, I mean, I think that's a the way I put it usually is like, it's, they're like, oh, I could never do, that's too depressing, and then that always hurts my feelings, because it's like I'm not free of emotion. If anything, I'm
Mhm.
soft, you know, emotionally. But the the lens or the optics for me is that that happened. The cancer happened. This person needs treatment, and the family's going through this. And it's more like, can you, just like with the eye example I used, can I make the experience, and I take that responsibility very seriously, as doable as possible, like within, you know, outside of what it is. I think there's a huge variation on what that experience is like for both the patient and the family. Very, like, you know, there's several degrees, like 270 degrees out of the 360. And I think that is where the responsibility, and I think oncology is a calling in any capacity, whether you're NP, treatment nurse. You know, treatment nurses are so foundational because they see them every day of their treatments, and they build a relationship. But I've noticed that anyone in oncology has that sense of responsibility. I'm just going to make a scary process less scary, and I'm going to do everything I can to accomplish that, and to make you your most confident and reassured self. Because having a lack of confidence or doubt can be very psychologically debilitating for both the patient and the family involved.
It's so important. Yeah, it's great what you're doing. I mean, I assume that you love it because it comes off that way, and not just on social media, but right now, like from an outside viewer, it seems like you really like what you do.
I do, but I don't get to do what I love to do most of the work week, right? That's the problem, is that the actual qualitative stuff I'm talking about is maybe 40 to 50% of the woes of practice. Like, and the other 50% is not any of that, right? It's like anything where I make that extra phone call to the father that couldn't make it or the brother, that's time away from my family and my children. And they're eating the cost of that every single day. And my kids didn't sign up for that. So, and that's because the day doesn't permit like the time for those calls. Like, that's the moral injury. At what point do you make your kids soccer practice and not then go back to the hospital so someone else can basically get the treatment for red tape that shouldn't exist? Like, it's like I have to decide to call for the prior authorization or just say, this is the world it is. I'm making my kids practice and it's going to take a week, versus if this was my father and my sister, I'm going to call, I'm going to sit on a hold for 45 minutes because that way I can get it approved in 2 or 3 days. And every single day I have 10 to 12 to 20 of those choices of something that's purely red tape or bureaucratic. And so the moral injury happens either way. It's either that you didn't do it for that patient that you would if it was your family member. I opt for doing it. But the eat at cost is the moral injury that I take upon myself is like, I didn't make my kids practice repeatedly. I didn't I don't work out anymore, like, because my thing is busy. And it's like there's just no, so I'm working to like basically open it up to where hopefully I can have 30-minute visits on the patients and just say, look, the cost doesn't matter. The you know, so that in that sense, the practice is a little different than the field itself. And in this country, in America, it's not nearly, even 90% of that. And but I'm doing a lot of things to try to fix that with tech and automation. And I think anyone listening, if you're in pre-med, I mean, it is going to be a different world, and there's no question you're not going to
Oh
be
yeah.
burdened by these kind of things where I'm documenting the same rote things over and over and over again, or the patient's going to be stuck with a bill. But it's like, what, it doesn't take an MD to document the same thing over and over again. And there's, yeah, dot phrases. So, that's a whole different podcast, I guess.
Yeah, I like that you got right into this because it's actually usually one of the last questions I ask when I structure these interviews is, what don't you love about your job? And I like that you're being so honest about it, because when I started this podcast, I that's what I wanted. I didn't want to just make another podcast or whatever videos where we're just talking about how wonderful our jobs are, because
Yeah.
they are great, and we all go into medicine for different reasons, but in the end, it's not all wonderful. And you have to be able, if you're going to want to go into this field and you're going to want to be a physician or a PA, you have to know that all that annoying paperwork and whatever it is, prior authorizations, that's going to be part of it. But like you said, then you made a really good point. You think that maybe it won't be part of it for them, which would actually be great, because then they can focus on treating the patients
Yes.
and helping them and helping their families.
Yeah, and there's a lot that needs to be done. Alliance for Patient Access, I work with them a lot. They have lobbyists and policymakers in DC. The thing is, when you're in practice, it's just you're so buried. Like I said, like that's your day, right? Like just getting through 70% of that day and having stuff, on the table that you start at 9 p.m. till midnight, at least as an oncologist. Um, a lot of those holdups, I think, slow down policy change, because when do you pull yourself out and be able to go to DC and sign that say, hey, this is ridiculous for patients and for doctors? Like, and
Mhm.
I think that's why things are so slowly or slow in evolution. But the resources are out there to make it better. But it's definitely burdensome. And I would just encourage anyone listening that if you feel like your doctor's kind of a jerk or callous, like, I think more often than not, you would be surprised how soft they are when you just approach that conversation or visit differently on an emotional sense. You'll get to uncover a version of them that you would be very surprised by. But it takes that level of tightness to even make it through your day to, again, be home for dinner kind of thing. And I do think it seems like it's desensitized, but it's a whole different bucket of problems on the medical side of things.
The other thing that you said was that your family does kind of take the brunt of when you have to stay late and care for a patient. So how do you deal with that work-life balance? Like, do you have a boundary? Can you even have a boundary as an oncologist? How do you do that?
Yeah, so like, my wife is also an oncologist, and so we're both in the same practice. We're both on call every few nights, and eh, that was one thing when we went in. I was like, I just don't believe that you can't set your own boundaries. That like, if you decide you're going to end at 5, like you're going to end at 5. Like I'm like, I refuse to believe that. Let me tell you a very simple example. Like, if my clinic schedule, people need to be seen. There's a huge deficiency of patients with cancer and getting care, right? That's all over the news. So you have to pack in your clinic just so people can even be treated. Like the treatments you have to drive sometimes once a week. Like you can't just go 2 hours and then go every 2 hours for months every week. So you have to pack it up. And then when you do, if somebody, not if, when your patients get admitted in the hospital and you're their oncologist, you're taking care of them for months or years, like you get a consult. One, most days will be one or two, like that got admitted, but someday you have four. That's all happening between eight to five. And the hospital team is saying, we need to see this patient, we need Rex, you can't. So what do you do? Like, how do you not go see the patients when your
Right.
clinic day is over at 4:30? This is impossible. So that in itself, so one solution is potentially to then end your clinic at 2 so you can make sure you see the consults. But what happens when a
Right.
consult comes in at 3 or 4? Like,
Mm-hmm.
that's where, if somebody would have said that, I don't know if anything would have been done differently, but that's a very easy example to appreciate of how setting those hard times, at least in oncology, is very challenging.
Well, let's back up a little bit, and I want to know the actual process, the path you took to going to med school, and then how your residency was. Did you go straight into med school from college, from undergrad?
Dude, I did everything straight, and I don't recommend
Yeah,
it. I really
same.
don't, because there is just not there is a severe stunting of growth and maturity and everyday life stuff that occurs until you're out there just is. It's just school on and on and on, and it's like
Mm-hmm.
when you finish high school or college, you grow up fast, right, in the real world. Adulting, as they say on social media. I never knew this. Adulting being was hard. Your adulting doesn't start until your 30s, like if you're an oncologist, and you're way behind. So I did college for 4 years, and then I like had a couple of fields of study. That was where I was trying to get the breadth of my education. So I did like philosophy and sociology and all these things that I was interested in, because it's going to disappear for a decade if you want to be an oncologist. There's no time for the next 10 years to learn those things. So I would pack in college as much as possible and edify yourself in whatever capacities you can. And I would encourage you to do something different than medicine. Like, yeah, I was pre-med biology, but I did philosophy and these other things because that's your one chance. That's your last chance to, like, you're not gonna be chilling reading books for the next 10 years outside of, doing what you're doing. And then you do med school. If you get in, your first year, it's 4 years. And then you apply to residency, internal medicine, which is required, and that's a 3-year residency. And then you apply at the end of residency for a 3-year program in hematology and medical oncology. It's two specialties put together as a 3-year program. Or you could go in on a 2-year program to just medical oncology, but then you wouldn't have heme, or so that would be challenging. So it's after college, it's the soonest it can be done is 4, 5, 6, 7, 8, 10 years.
Okay. And did you do a fellowship as well?
Yeah, that's what, like, you can't do the fellowship in oncology and hematology until
Oh, that's
residency.
what you were saying. Got it.
Yeah, so
Okay.
4 years of med school, 3 years of internal.
3 years of internal medicine and then the fellowship. Sorry.
Yep.
Yeah, that makes sense. How much of the hematology side do you do? Is it kind of 50-50, or are you focused more on the oncology side? And do you see just heme patients as well?
Yeah, it totally depends on what you want to do and where you're located. But I mean, I want to stay sharp on both. So I see plenty of heme, and heme can be broken down into benign hematology, which means non-cancer related, and then obviously malignant hematology, which is multiple myeloma, lymphoma, leukemia. Um, but I'm passionate about benign heme because I talk a lot about iron deficiency on my social media. I do think, not think, I think it's pretty known that medicine is inherently quite, sexist, or has been, at least on the shoulders of things slanted more seriously for male dominated diseases compared to females. So hopefully it's being, I think, rectified at a faster rate than before. But like, iron deficiency is one of those that not only show quality of life measures and debility, but actually increased mortality for women like, between 16 and 30 years old, because they're just basically, nobody takes their iron deficiency seriously. And there's a huge article that came out over the summer that shows there is an actual mortality difference if the iron is not replete. And I'm not talking about iron deficiency
Wow.
with anemia. I'm talking about just iron deficiency, like even
Oh,
without being anemic. So, if your MCV, the size of your red blood cells getting small, you have fatigue, you have like kind of these restless legs at night, and you're having difficulty sleeping, decreased libido, sex drive, for a long time it was always like, oh, you're depressed or you're anxious, whatever. But like, check an iron, bro. I mean, if somebody's having heavy cycles, like that makes, you'll see hundreds of comments at this point on my socials that are like, I've been on 3 medications for restless legs. 3. Like, I'm zonked out all day. The next day, I saw your podcast and comes 3 months later, or I saw your video and I'm off of all of them. This is obviously an extreme example, but it had probably 175 likes of people like reflecting the same thing. I'm off of all my
wow.
RLS meds. So that's all benign heme. And then blood clots and bleeding disorders and stuff like that.
So that would be, I'd say, your tip for the general public is to make sure your doctor is checking your iron levels.
If indicated, yeah.
If
Yeah.
indicated. I feel like I already know the answer to this, but do you feel like you would have done anything differently in your path to where you are now? I know you said you went straight through and you wouldn't recommend it. I don't
Yeah.
recommend it either because I mean I'm a PA, so I have a lot less schooling than you did, but I still don't recommend going straight through because I was completely burned out. So, what about you?
Generally, and this is anecdotal, but for example, my wife, like she was 6 years, like she spent years before she went to med school. Her mom got breast cancer and all that. So she was like doing forensics, like, CSI stuff, and then teaching at a university, and then decided to do that. And her and all the kind of older, the people that came to medicine later, there's just a poise, durability in my anecdotal experience that you find. And that's because they had to grow up before they went through something extremely psychologically and emotionally challenging. And I think for that reason alone, you're a more accurate version of yourself, a more defined version of yourself when you've been out there and formed. Like if you're Play-Doh and you take shape over time and over experience, you get to shape yourself a little bit more. That way your feelings and emotions are better bridled than, something that's fairly germinal or nascent and still taking shape, and you're kind of stunted in this grown up high school world for 10 years
Mm.
after college.
Grown up high school world. I could see how that makes sense. I don't know. You can't get back those years, but I think there's also now better opportunities to take some time off and um, maybe take a sabbatical and cure your burnout. Yeah, I would have done the same thing. I would have taken at least a year off. All right. I want to talk about since being a hematologist oncologist is so time consuming and takes up a lot of emotional energy too. How do you do all the social media? I mean, you do such a great job with it. And then also, why did you choose to go the social media path? What's your agenda with that?
Yeah, so I was never someone, there's two kinds of quote unquote creators, people that have been doing it a long time, YouTube and other things before Instagram and TikTok. That was not me at all. I ended up my chief fellow year, my wife was already starting practice kind of 4 hours away and had the kids. So I'd drive down every weekend, which was a whole nother thing. But I downloaded TikTok to basically uh, just kind of stimulate the right side of my brain. Like it was just,
Mm-hmm.
I love the anonymity. Like every other platform, you have volitional following based on you search for your friend and all this stuff. And TikTok wasn't like that, especially at the beginning. And so I just did dances and stuff. I'm a Gemini, so I had this like performance stuff. And then it started getting very like, quote unquote viral or whatever. And it
Yeah.
kind of ties back to, a fundamental concept I have that like, I just don't think you should, I think it's dangerous to do anything in vain. Like if you don't, if you receive anything positive from the world, whether it's follows or likes or attention or thirst, whatever, name your metric, right? I think it's parasitic if you don't take it to say what is the reason for this. And so that was some concept in my Indian culture, and my mom really instilled on me. So I was like, what do I talk about? And at first I talked about kind of gender bias in medicine because my wife has the same 3 board specialties. She actually had a master's before, and we were treated very differently, right? By males, females, everything. We had different experiences when we consulted surgery, for example, and things like that. And so I talked about kind of how discordant that was. And then that went or transformed into, well, let me talk about what I really know and what's really scary. And there's a huge deficit of, and that's cancer information. There's so much fear mongering, gaslighting, misinformation. And what I think is particularly vile is sinister, is actually capitalizing on hope with e-commerce and stuff and selling black oil, snake oils, and saying, "Oh, look, this is a non-chemo way." And this happens way more than anyone listening understands. I'm talking dozens of thousands of dollars spent by somebody that's middle income because of the kind of older culture of not sharing as much. Like, oh, don't do that. It's a doctor. It's liability, and it's more complicated.
Mm-hmm.
And I think we just got to scrap it, because people are taking advantage of the fact that with education and information is trust. And so they're
Mm-hmm.
providing these things that may or may not be factual, and we're staying quiet. And I was like, that's not okay, especially when it relates to preying on someone's hope for life in cancer. And so that's what then kind of drives and facilitates that, which is, again, what is the need of the universe? What did the universe do for you and position you? And I think there are thousands of more people more deserving to have gotten into med school, residency, everything that I've done, and I hope everyone feels that way to some degree. I didn't have a single parent that had to work 24/7 and me take care of my, little brother. If I did, then, and there are people that do, then, it becomes more challenging. So even that's a liberty. Having your five senses is a liberty. And so what do you do with it? And for me, it was, okay, fulfill a need. And I think anyone, if you're unsure of what to do, both examine what you're passionate about and fulfills you, what you're good at, really. What are the trades you've been blessed with, equipped with? Are you a good talker? Are you a good, at reading people? Are you good at execution and algorithms? And then examine what the world needs. And I think that helps alignment more than not doing the second part, because now it may be more stress or impositional. And I think there's harmony found when you think of it as input and output, connectors. And that's what social media is to me.
I can relate to that a lot. I think in almost every way. Just, well, I'm a Pisces, so I'm a bit more emotional, maybe. But what I get emotional about is like making sure that the people know the truth. And then I kind of applied that to medicine and my field, which is, again, is orthopedics. But I just get very passionate about people who are either being taken advantage of or are not given the right information, but they believe it because this one doctor told them they needed surgery, but really they don't. And so this is the kind of stuff that I like to put out too. So I understand that. And then also just about my profession, because there's a lot of people out there who still don't totally understand what a PA is. So then that's kind of how my TikTok started, was when I started making PA videos, because I didn't know what I was doing. Like I said, I was just like dancing or something. I don't even
Right.
know. And then came the student loan things, which is so important for anyone who wants to get into medical field, because a lot of you guys are going to have student loans. And it's important to understand what that means, and not only when you're taking them on, but afterwards, and how to like budget and things like that, and the different programs that are out there for like forgiveness and grants and things like that. So anyway, yes, I agree. My social media agenda is very similar. I just want to make sure people are taken care of, basically, I guess.
Yes, exactly. I mean, you were gifted insights and experience. And I think social media offers a way to really just catalyze people's evolutionary process again, in knowing themselves and knowing how to navigate. Like, we lived in a world where you were at the mercy of someone you ran into within a 30-mile radius or wrote a letter, but nobody's going to write you a cold letter, to now having this vast access to basically have the roads that had to be otherwise explored independently now pay for you. And
Yeah.
that's what social media. I mean, you can just have all these paved roads, and I've experienced. I mean, it's like reading books on biographies. Like, these are high value experiences that take decades or lifetimes, that you can just basically aggregate and grow yourself, hopefully for the best version of yourself, for the world. Like, the
Right.
second part, I think, is so important. Like, you can't just take it all and then go get on a boat. Like, you just stole. I feel like the universe just kind of goes like,
Yeah.
like we all, everything was positioned, and then they didn't do anything with it. I think that's why, oddly, I was saying this to somebody, people like Leonardo DiCaprio and like Bill Gates and stuff. I mean, they get very wealthy and successful, and you find this like it's not a PR stunt. They get very passionate about something. Like Leo is all about global warming and stuff, almost to where you're like it's like, oh, is he a fanatic? And then like Bill Gates with like third world. But I think that's where the universe doesn't have to sigh a heavy sigh, but it's like a celebration because it's like you feel like towards the end of this success and this positioning, somebody is doing something not for themselves, not because Leo did or Bill did it, but because I believe they feel the same way. Is that now what? What do you do? What was the reason for all of this in my lifetime? The success, this optics, the visibility, the money. That I think is fulfillment when you're on your deathbed. There was a quote that said something about like the money, any of that, the thing, all that dies with you, all of it. But what does grow and continue ripple wise, and not because of the vanity of it, but just because of the moving forwardness of it, are the ripples that you were able to create in that lifetime.
So true. I agree. It's really important that you do something with what you build and with your knowledge. And I like how you keep saying like you're gifted this, whatever it is that you're gifted, and then using that. So let's just pivot real quick and talk a little bit about your podcast. I admittedly have not listened yet, and I need to. So tell me and tell our viewers and listeners like what is this all about? Why is it important that we listen to your podcast?
Yeah, so it kind of mirrors what social media did originally, and I kind of pride myself on being the kind of layperson with a medical degree, like a blue collar person with a medical degree, right? Like I didn't. My parents are doctors, very they're intelligent. I love them. They're amazing, but I'm a guy that is a layperson with a medical degree, like that understands oncology, and that's what my content is. It's to be able to speak the language with metaphors on engines and stick shift and the stuff that I just know outside of medicine. And so my podcast is that. It's called Target Cancer Podcast, and I half joke, but it's not a joke. It's like I am an LSU trained, like I love LSU. I'm very grateful for everything. It's the only tattoo I have is of Louisiana, but the fact that as a community oncologist in Louisiana, my podcast, I've had Pulitzer Prize winners like Siddhartha Mukherjee wrote Emperor of All Maladies, one of the most famous books.
Wow.
Jason Fung, best-selling author of the obesity code, the cancer code, the diabetes code. I mean, people I have no business sharing air with. Like the first director of Cancer Moonshot, like he worked with Greg Simon, worked with Al Gore and Obama, and it's been very humbling to have guests of this magnitude, and it's all because there is such a deep shared joy and fulfillment with identity and community. And so I'm trying to foster that. Is like, yeah, I'm a traditional oncologist that writes chemo, but let's have metabolic specialists to talk about the no sugar thing. Like I think that ultimately fosters trust, not to just dismiss. I think there's some truth to every hyperbolic radical statement on social media, the stuff that does kind of prey on hope. There is truth to that. So instead of saying like, this is like, nonsense, blah, blah, it's like, well, let's explore why people think sugar feeds cancer, right? And so that's fostered, and I hope it's helpful. But it's crazy. I don't have any media background or Harvard education, but I think about last month or two we reached in over 100 countries and 1 million views, and it's been
Awesome.
it's and that's the power of of birds of the same feather kind of community building that you can find in this space.
Yeah, well, I can't wait to listen. And I'm sure our listeners will listen as well because it's such an important thing. I mean, you're doing awesome work, and I still don't know how you have time for all of this. I'm hoping you have some sort of social media management team
Oh yeah.
because, yeah, I don't know how I would do all that. And also, I love what you said about it can't just be one way. Like Western medicine is great, it's life changing, right? It's but I've always had this thought that I think the perfect combination is like listen and follow your doctor, but also kind of like keep an ear open, an eye open at the Eastern medicine kind of situations, because I think it's really a full circle treatment if you're taking care of your body in natural ways, but also following the advice of your physician. I don't know. I just think that it's very dangerous to just kind of have like tunnel vision in one direction and not at least listen to what some people are saying and pick apart why they're saying it at least.
Yeah, I mean, if we have a systemic illness as people, at least in this country, I think that illness, and I just cannot understand it, is we are so divisional. Like, I don't know why everything is becoming so polarized. And it's like, if you even
I
like,
know.
I just don't get it. I mean, it's like, whether it's Democratic, Republican stuff, whether it's socialized medicine or not, it's like, why does everything have to be so divisional? And it really concerns me. And I think that's in a secondhand way, that is what I'm trying to do with these things. I mean, I'm the CMO of WebMD, and people think of one way about WebMD and entrepreneur. Like, I just want to show, I want to humanize ultimately the fact that we're all fucking human, excuse my language. And we're all trying to make
Right.
things better. And yet we're only inhibiting ourselves by
Right.
being oppositional and divisional. Like you can disagree. I'm all about, I was telling somebody last night at this event, and I was like, it's fine if people don't believe in what I do. I'm like, I actually respect if they don't support what I do. But to go out of the way to get in someone's lane and to thwart it, that to me is a lane that I couldn't do, right? Like, so I disagree with things, but ultimately the same thing with traditional medicine versus not. Like, why does it have to be so radically divisional? Like, it's like,
Hmm.
you know what I mean? And it goes for everything and a gazillion things. And I uncover that more and more. They say as you get older and more wise, you get kind of more bogged down with the depression of, truths. Like, I don't believe that wholly, but I can appreciate that sentiment, I guess.
Yeah. Yeah. Well, I think you and I can continue to hopefully try to unite the people, at least on the subjects we talk about. So, but yeah, I agree. It's scary. Scary how polarizing things are becoming. Oh, let's talk about Medfluencers. So, I definitely want to know how this got started because I am part of it now. So, thank you for that. And I really want to know how you guys came up with this. I mean, it's an awesome concept. I'm really glad you did because it seems like you're protecting medical influencers. So tell me about Medfluencers.
Yeah. And before I do that, I think one important concept that you had somewhat touched on is the whole financial aspect of an education, right? And what I discovered in the last 2 years, one of the main reasons for burnout, especially with the medical school loans, your hundred thousands of dollars out, is you feel suffocated and stuck because you depend on these RVUs or these metrics that the traditional healthcare system has made you believe is the only way to have a ROI, a return on investment of your education. And that, I'm here to tell you, that is not the case. And you will not know it until you leave the world, which I haven't left. And if you're lucky, like in my case, again, basically letting you shoulder what I've had to very serendipitously either seek out and had blessed to find out, is there are other ways to subsidize and bring a commodity value to your education and investment. It is not just RVUs or private practice setting. And somebody says, "Yeah, Sanjay, that's why I do real estate," because now I'm like, dude, that's actually leveraging your money. That's not actually leveraging your degree. And there are all kind of avenues where actually having your education is valuable. And there's other ways to be able to basically find different streams of value and revenue to that education. So with all that said, with social media, one of my concerns, especially in the cancer space, is anyone can say anything, right? The other concern was people are mean well and are sharing information because they believe it needs to be known, but nothing is equipped for this. Not the regulation terms, not the campaign, like nothing, compliance. It's all a new world. And so with Adam Goodkoff, See the Med Life, him and I co-founded along with Josh, JMac, a couple of people. Let's make sure that this thing is well defined. And then also, people try to compensate you basically on older metrics, like, oh, you're a physician, so we pay physicians this and that's a fair market value. The same physician that's like at a university that doesn't have any following, they don't apply the commodity of what a niche following is. They act
Right.
like it's irrelevant, but they'll pay a celebrity, they'll pay Dr. Sanjay Gupta because, like, oh, people know him. But it's like that somehow doesn't apply, even though sometimes arguably you have a higher volume and concentration of your ideal consumer or client based on years of work of an aggregated, following. So all that to say, Medfluencers, most importantly, is for things to be done responsibly, because it's gone completely off the rails with no regulation on people taking deals and this, that, and the other. So we look into the licensing and all this like very unsexy stuff that nobody wants to do, basically, for lack of a better word. And then also to kind of, you know, basically be an advocate for the very weird and challenging waters that nobody really sees unless you're a creator, that have to do with the work that goes into to have something like this happen, and then also what you've kind of fostered and how valuable that is for people getting paid a lot of money, 10 times what anyone does as a creator currently, for the same exact thing. But because you're a
Right.
physician, it's like you can't commoditize on like that. I don't think that's fair necessarily either, you know.
Yeah, no, not at all. I get so many inquiries to do ads and or whatever it is, and I love that you guys created this, especially because you're doing the work to look into the different brand deals and things like that. At least that's what I understand. I actually have a meeting with somebody from your team next week to kind of understand how they can help me with something. So I really appreciate that because I don't know what the ins and outs of this industry
None
are.
of us
And
do. The liability is so high, and anyone that's coming to you, the company or the agency, does your best interest is not their best interest whatsoever. The only thing they care about is their compliance and regulation for either as an agency or as the company. That is the maximum amount of of caution they're going to use. What happens to you as a consequence of doing this and has to do with boarding and licensing, that is not their problem. And nobody has done anything to say, whoa, who's got the back of the actual creator that's participating, or do they even know what
yeah,
they're doing and what the liability of this looks like without this being in the contractual terms? And it's not a fun undertaking. It's been exhausting. I'm far more gray than I've ever been, in part with patients, but also trying to protect a whole bunch of good people that can be really put on a stake for something that ultimately trying to do well. And I think that people need and deserve, which is education from trusted individuals and helping bridge the trust of traditional medical system and getting out with this whole patriarchal, I don't need to tell you, you just do. Like, gone are those
hmm,
days, and they should be.
yeah, right. So real quick then, for the people who might be listening who are influencers, medical influencers, like, what would you tell them? Do you have any advice for if they get a campaign for something like, I don't know, even just an over the counter medication?
That's very dangerous. So there's a lot of legal. I mean, you can pull it up. You can, I forget exactly what it's called, but these things are defined, and you can just Google and pull up from these government sites and these licensing sites, depending on what kind of professional you are, and say what is, look at Stark law, look at all of these things, like what's considered physician kickback. All of these things are very well defined, and you will find a significant portion that by these what we consider older definitions. So there's a lot of legal work and a lot of money going into having a different definition that we're working on. But they are direct infractions, and that's why I've been, if anyone sees my content, they'll see that I actually don't have that many sponsored stuff or ads unless it's organizational or whatever, until those things are defined. Or you can, I mean, of course, you can always just come to Medfluencers, and we can, that's where we help with the what kind of business insurance, all that stuff is very important. My one tip, if anything, is anyone that takes a dime for any reason should not be doing it as a uh, individual, right, on the tax. Like, it definitely should be an LLC. Like, that is at the bare minimum, which is very easy to do.
Yeah.
But if you
Yeah.
sign something, if you received a check with your social security number, do not
Hmm.
let that happen again, because now you've already linked that to your degree.
Yeah, it is scary, and I definitely like am so grateful for Medfluencers, if not only for this reason too, just to be protected, feel like you have somebody on your side. So I thank you for that.
Oh, of course.
Last thing that I ask most of my guests is if you have any tips for upcoming medical students or even high schoolers who are thinking about going into the medical field, becoming physicians, maybe even going into hematology, oncology. What are one or two tips that you can give right now to our listeners?
Well, I think I'm going to give one more general, and I think it's important. When people say about cancer, like, oh, it's depressing and this and that, like, I would say it's true. It's very, very humbling. Like, on a daily basis, right, on a weekly basis, I have somebody coming out of law school that has leukemia, and I have somebody that's my age and younger all the time with stage 4 cancer. And so it makes you appreciate, like I said, that date that's above our head. It constantly reminds you that you are taking something as a presumptuously as a guarantee if you think, 75, 80, any age that you're going to make. But that's not necessarily depressing. Like, if anything, that is the catalyst to make sure you make the most of the time you have, any of us have. And I find all the time when I'm trying to mentor people is the greatest deal of distress sometimes is that goal or that task or that, whatever you have in mind to get in med school to whatever, a lot of distress happens trying to continue to put that, square peg in what you thought was a square hole, and it may have become a circle. Like, it's just not, and even if you got in, but my point in saying that is more granular. Reevaluate what you think your purpose is. Like, you have to re-engage again with the universe, your surroundings, the circumstances, socially, and everything, your health, to say, is this still what I want? It is not quitting or a failure if something doesn't feel, quote unquote, right, or the destination like it did a year ago or 2 years ago, 4 years ago. It's just not the case. It's like, because you are growing. It's only the case if you didn't grow at all. If you flatlined and you didn't evolve and transform and shape and talk about making the Play-Doh that, is just at the beginning, nothing. And then it can be these really amazingly detailed things. That is happening to you through your lifetime. And re-examine each set of new variables and adaptations of the person that you are today based on who you talked to this past year, whatever, and say, is this still it? Whatever that may be. And the way I have it, my goals is, like somebody else says, short-term and long-term plans. I don't really like those metrics. For me, I have a 3 to 6 month plan and I have a 2 year plan. And I don't really think beyond 5, or 10 years, to be honest. But what that helps with is anything that causes you duress or unhappiness today, ask yourself, is there any actionable plan to change that at the 3 month mark and the 6 month mark? And if you don't have one, just realize you are letting some impairment or some distress, some stressor just exist with no plan to let it not unexist. So that's very important. And I think I'm telling you that shouldering a lot of grief and emotions and angst, like of seeing people pass and come and go, and the advice that I get as an oncologist. But, I'm saying that in homage to everyone that I've had the privilege of taking care of. It's like, you've got to make the most of the time that you have. And the more you listen and feel good about something, then when you fail repeatedly, it doesn't matter, because repeatedly that is where you're meant to be. Or if you're successful and you're like, why am I upset? Why am I anxious? Why am I depressed? I got into med school. I got into residency I wanted. Like, now you're still forcing it, even though you didn't fail on paper for the admission. But now it may not be a square hole that with the square peg that you thought. And that's not failure either, to say I quit, because it's just not what you want. And so, or like who you are today. And that, if you do that, there is a place already meant for you. And you find that only with reconsidering who you are and where you're headed. Otherwise, like I said, kind of an overlying theme with the podcast, otherwise you're imposing or trying to put a stress with some kind of either stubbornness or pride or belief that it's a failure to do anything otherwise based on a plan that you made on a more nascent version of yourself, which is crazy.
Yeah. Wow. I feel like everything you just said was very profound and it really hit home. So, this tip is probably my favorite so far out of everyone I've interviewed. Thank you for that. I agree 100%. You have to have passion for what you're doing, and you're not going to love it every day, but if there's no passion involved, or you're finding yourself depressed, or like you said, maybe it's not the right path for you and it's not too late to change. But yeah, I
Yeah.
agree, and I love it, and that was awesome.
Thank you. I mean, summed up on a shirt, it could just say, like, what's the plan, bro? Like, as in, like, if you're
Yeah,
unhappy or more days are stressful than not, what's the plan? And it's fine if it's
yeah,
like in a year you have the goal and something's gonna change in a year. That's fine, because you have a plan. But if you ain't got a plan, you need to really ask yourself, what's my plan, dude?
yeah,
Like, you know what I mean? Like,
right.
that it sounds so silly, but it's real.
It's real. And someone I interviewed said something cool, like, we find it so easy to complain. It's easier to sit there and complain about your job every day than it is to actually make a change or make a plan to make a change. And
Yeah.
it's so true. But then I think once you do it, you'll probably find it. I mean, as long as you're following your passion, you'll find that it's worth it.
Yeah. And if you want to do something even a step forward, we didn't really talk about kind of the tech stuff and AI stuff I'm involved in, but I'm hedging on the commodity of like my investment in my education in some of these things so that people won't feel like I feel about some of the things that burn out. Because at the end of the day, oncologists are needed and people need a good oncologist and they need education. So like that's a way when you can make the most things align, one for yourself, but also to hopefully spare someone else of something you have identified to be a problem, then you're really winning in the universe, right? Or the universe is winning. And so the more you can kind of tighten, like it's like, oh, 2, 3, 4 birds with one stone. I think that fulfillment and reward can kind of push off burnout even more effectively, but also it makes you weather less quickly because you're doing it for multiple birds in one hand.
Right. Exactly. I thank you so much for doing this. I think you've brought so much good insight, and hopefully I know people will find this episode helpful. You are actually, just fun fact, my first physician non-surgeon on the podcast. So this has been a really enlightening for me as well. And I wish the best for you. I can't wait to see what you do with all of your different projects.
Oh,
Thanks for being on my podcast.
yeah, of course. Thanks, for everyone listening. You're trying to do the most for yourself, and honestly, if you're under 30 years old and listening to this, you're in a better position in the world than I was. Like you're literally ahead of even me, and I mean, I never had the proactive wisdom to just better. So if you've made it to this far and you're listening to it right now, you're winning. You're set to win, and I want everyone to basically take home that message. And if you want to follow any of my stuff, it's the Onc Doc is the handle. It's on blood and cancer stuff, and the podcast is Target Cancer Podcast.
Definitely go give Dr. Juneja a follow. You won't be disappointed, I promise. And thanks again, and I hope to meet you in person someday.
That's a must. Thank you.
This is the So You Want to Work in Healthcare podcast. Don't forget to subscribe to stay up to date on the latest releases.